Now in Lagos, where 7 private laboratories in the state have been added to the 4 government laboratories that have been licensed to conduct tests for COVID-19.
Lagos State made it fairly difficult to qualify to be able to look after COVID patients because they wanted to make sure it was done properly. So they laid out some criteria which everybody who wanted to look after COVID would have to follow. So they set out the guidelines, and we all had to meet those guidelines, and we were inspected several times by HEFEMA, Lagos State, different arms of the government.
We have certainly felt the impact of COVID-19, and it has become clear that we needed to respond in some way to supplement the current capacity in Lagos State for managing this disease, which does not discriminate.
This is important for us as a government. It's a clear demonstration of the power of collaboration, the power of ensuring that we cannot do it all by ourselves. And so when the public issues arose and the private sector raises up to such occasion, the least we can do is to encourage them.
If you felt that you had any of the symptoms of COVID, you could go to any of these sampling sites, get your sample collected. You would also be seen by members of the primary healthcare agency or the board, and if it wasn't COVID, they would give you advice on what else to do, but we would certainly take your sample for COVID. And that gave us a very good idea of what the virus was doing all throughout the whole of Lagos at any point in time. So we were always getting live data day by day, and we had data per local government area.
Almost every city, every capital, you have a federal research institute. They've not been funded, they have all been grounded. If the federal government will recognize that now that we are faced with a world in which we may have to live with recurrent pandemics, we need to reinitiate research.
The only way we can move forward is for us to be research-oriented. That's what I'm talking about, sequencing. Sequencing is not something an institution can do on our own. You must have a network of research institutes, and that one we are pursuing on a daily basis. There are clinical trials going on concerning chloroquine, concerning even ivermectin.
Lagos State again has proactively responded. You might have heard Mr. Governor speaking about the establishment of an infectious diseases institute in Lagos State. So that's one thing that the COVID virus has done. Lagos State has again thought ahead. There's going to be an institute where people are going to be trained about the management of infectious diseases.
This institute started as a yellow fever vaccine research and production center. It's really not new to Nigeria about vaccine production. We have currently institutions that are producing vaccines and developing vaccines in animals. The Veterinary Institute in Jos. So there's a platform that we can actually use to learn how to move from animals to man.
Now we are realizing that the vaccines that we're promoting are not working in certain parts of the world. That doesn't mean we should just sit down and throw our hands up and surrender. What we do then is we modify the vaccines to fit the evolution of the virus.
We are working on coronavirus vaccine. We are using what we call the recombinant method, where what you do is having determined the viral architecture of the coronavirus, we look at the active part of the virus that elicit immune response in the individual, and then see how we can clone that part and then synthesize it and use it to elicit immune response in animals on human cells. At that stage, if it elicits antibodies from the animals, then we can claim that we have a candidate vaccine. We are not looking at only coronavirus, which is the current challenge. We are looking at a situation where we can have a robust outfit that can design vaccines for whatever epidemic or outbreak.
We were ready for our index case as far back as January. It didn't happen till February 2020. And we knew that as soon as a case came in, we would do everything to contain it. Even in the first wave, we realized that this virus is behaving differently in this environment. Now, you can put that down to the weather, the food, the genetics, Lagosians being exposed to other pathogens that give them some kind of protection against COVID. We tend to have a younger population and a fitter population, able to withstand the infection better than people in the northern hemisphere who are older. So some of those factors helped us here in Lagos, that it didn't cause as much severe to critical disease as we were seeing in Europe and in America.
COVID in disguise is more like an educative blessing to waste management in terms of medical waste. So we've developed a guideline that we're giving to all our medical facilities, pharmacists, on how we manage waste. So we came up with that at the end of the year to give to them. Also, we're running online waste management courses for them through Loma Academy as well, for them to understand the importance of separation of their waste from source. And treating those medical waste very well is something that's very important to us. We have an arrangement with one of our private vendor, ABC Sanitation. They are specialists in management of medical waste. So they use incineration system to dispose medical waste. So things like boxes, needles, plastics coming from hospitals, bloods and stuff, they go there and then incinerate them.
When the travelers arrive here, what we do is that we contact the DSNO, that's Disease Surveillance and Notification Officer in Badagry. So they will arrange how these people will be tested. So after the test, those people will go. If it is possible, the contact will be traced and those people will be monitored. They have a crew in charge of that. To my right, that's the exit from Nigeria. Then to my left, if you are coming in from Nigeria, this is where you come in. There are officers on ground at the gate to know your mission in this place.
The Lagos State government has rolled out the Oxford AstraZeneca COVID-19 vaccines, with the State Commissioner for Health, Professor Akem Bayomi, leading the health workers category by taking the first shot.
Let's welcome the Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu. You can go on. You can see the governor is about to be injected, and it is done.
As you can see, I just had my own shot of the AstraZeneca vaccine. Just about 2 minutes ago. I don't feel anything. I want to first commend all of our numerous health workers. You know, this still remains our epicenter for the COVID-19. And so they've started administering the vaccine to a lot of our health workers who are indeed the frontline staff that we've talked about. But they've been gracious to allow me to also come in and take mine, and we'll continue to have our strategy rollout. So, so this is my card. Thank you, all the health workers. Thank you very much. Thank you.
So a vaccine mimics the infection and primes your immune system so that when you're exposed to the virus, either you've had the virus before and your immune system is alert, or you've been exposed to the vaccine and your immune system is alert. And what that does is that it either prevents the virus from infecting you, or if you do get infected, you have a mild illness because your immune system is now alert, kicks in faster and stops the virus from developing into a full-blown infection.
The card can be faked, but the barcode cannot. It goes into an international database, and once they scan it, it will bring up your details, and they will compare it to your legitimate ID card.
In the last 10 years, we've seen more zoonotic events than in the last 100 years. So that tells us that we're moving into this era of emerging infectious diseases, which the WHO and other such like global health security agencies are warning that these events will keep happening over and over, and we need now to build a biosecurity consciousness amongst human beings. We need to build biosecurity roadmaps. We need to be careful about how people move around in the ecosystem. We need to be careful about how we import animals into our cities. We need to be careful about how we breed agricultural produce, both plants and animals. You can't just keep doing what you want. Nature will catch up with you, and nature has caught up with us now in terms of climate change and this pandemic. So I think everybody is now a little bit more conscious of the consequences of ecological damage, the consequences of disobeying the laws of nature. You've got to watch what this virus is doing. You've got to watch what's going on around the world, and you've got to take those examples and not cut and paste, but adapt it to your environment and plan ahead. COVID takes you by surprise, and what we've been trying to do in Lagos is stop reacting to COVID, but being proactive and always thinking, what is this virus going to do next? And then plan for that so that we are ahead of the curve and not behind the curve.
I do not think that there's any other state that is capable of responding the same way that Lagos has responded if they got the kind of numbers that we got.
In the environment of a rapidly expanding outbreak caused by a pathogen either of novel nature with a changing dynamic, then that environment needs to start research almost immediately.